Did you know your own body might be trying to warn you about heart failure right this very moment? It's a sobering thought, but thousands of Americans over 60 discover they have heart failure too late, often dismissing crucial signals as just getting older. Like many of us, you might be overlooking little changes every day. But what if those subtle shifts were actually urgent warnings doctors instantly recognize? What if you could spot these life-saving clues just by looking in your own mirror? In this video, I'll pull back the curtain and reveal 6 grooming signs that could literally save your life. Stay with me, and by the end, you'll be empowered to take charge of your health, ensuring more years of healthy, independent living. And please, don't miss the last sign. It's a silent alert almost everyone overlooks. Before we dive in, I truly want to know how many of you have faced this. If what I just shared feels familiar, please comment a simple yes below. It shows me you understand, and it shows others they are not alone. Okay, let's get started. Sign 1. Unusual nail changes. Now, when was the last time you really gave your fingernails a good close look? Not just a glance, but a proper examination. Have you noticed any little changes in their shape, their texture, or even their color? These seemingly minor shifts, the ones we often brush off as just another part of getting older, might actually be your body's desperate way of trying to warn you about a failing heart. It's a message, clear as day, if you know how to read it. You see, our hearts are truly magnificent pumps, working tirelessly every second of every day. But when that pump isn't quite as efficient as it used to be, that oxygen-rich blood, the very lifeblood our bodies depend on, doesn't quite reach your fingertips and toes properly. Cardiologists at the American Heart Association often tell us that changes in your nails can actually be some of the very earliest visible signs of poor circulation. It's a fundamental biological truth. When the heart struggles, the extremities are often the first place to show it. Dr. Jennifer Hay, a leading heart failure specialist at Columbia University Medical Center, puts it so simply, yet profoundly, when she says, "The nails can act as a window to your cardiovascular health. Changes here often precede more obvious symptoms by months or even years." Think about that for a moment. Months, even years. That's a lot of precious time to catch something early. Let me share a story that really drives this home. Take the case of Eleanor, a vibrant 71-year-old from Nebraska. For quite some time, she had been noticing her nails becoming more brittle, and some of them were even starting to curve downward, almost like tiny spoons. Like so many of us, she just figured, "Oh, it's just another part of getting older. What can you do?" But her daughter, who happens to be a nurse and has seen a thing or two, recognized these changes as potential clubbing, a classic sign that can point to heart or lung problems. When Eleanor finally listened to her daughter and saw her doctor, tests shockingly showed her heart was working at less than 40% capacity. "If you hadn't come in when you did," her doctor told her, with a look of genuine concern, "we might have been having a very different, much harder conversation in just a few months." Her nails, those little pieces of keratin, were literally trying to save her life. So, here's what you need to do immediately, today, if you haven't already. Take a moment, find some good light, and really examine your nails. Are they starting to look a little bluish, especially under the tips? That could be a sign of poor oxygen circulation, where your blood isn't getting enough oxygen. Have they started curving downward at the tips, creating a rounded, almost bulbous appearance, much like those tiny spoons Eleanor saw? This clubbing is a serious warning sign, one that should never be ignored. Have your nails become unusually brittle, breaking easily, or developed ridges that weren't there before? All of these could be your body's urgent attempt to tell you something serious is happening with your heart. If you spot any of these changes, please, don't wait for your next scheduled appointment or hope it'll just go away. Call your doctor today and specifically mention these nail changes. When it comes to heart failure, time is absolutely critical, and catching it early can make all the monumental difference, maybe even between a simple medication adjustment and a major, life-altering heart surgery. Is waiting another day truly worth the risk to your precious health, to your future, to your independence? You decide. If you just said, "Wow, I never knew that," comment "Wow" below. Let me know what you're seeing, what you're learning. Sign 2, unexplained hair loss or texture changes. Now, this next one might surprise you, because we often think of hair as just a cosmetic concern, don't we? But the truth is, the way your hair looks and feels can actually clue you into dangerous heart problems long before you ever feel that familiar chest pain or shortness of breath. Are you noticing more hair than usual in your brush? Perhaps a worrying amount? Has your hair suddenly become dry, brittle, or changed its texture dramatically from what you're used to? If so, your heart might just be sending you an urgent warning, a quiet plea for attention. Here's the science behind it, in simple terms. When your heart starts to struggle, when it's not pumping as robustly as it should, the blood flow to certain parts of your body can diminish. And believe it or not, your hair follicles, those tiny little pockets in your skin that grow hair, are extremely sensitive to a decrease in blood flow. Research published in the Journal of Cardiovascular Medicine actually shows that this reduced blood flow from a failing heart often affects the hair follicles first, causing noticeable changes months before more serious symptoms even think about appearing. Dr. Richard Sender, Director of Preventive Cardiology at Jefferson University Hospital, explains, hair follicles are extremely sensitive to decreased blood flow. When the heart struggles to pump efficiently, nutrient delivery to the follicles diminishes, often resulting in visible changes to hair quality, texture, and retention. It makes sense, doesn't it? Our hair needs nourishment, just like every other part of our body. And if it's not getting it, it shows. Let me tell you about Arthur, a 73-year-old retired accountant from Minnesota. Arthur had always had a full head of hair, a source of pride for him. But over just 3 short months, he noticed it thinning rapidly, almost like it was falling out in handfuls, and it became unusually dry and brittle. His wife, bless her heart, insisted it was just normal aging, a common refrain we hear. But when he casually mentioned it during a routine checkup, almost as an afterthought, his doctor, with years of experience, immediately picked up on it and ordered cardiac tests. The results were startling. Arthur's heart was only functioning at 35% capacity. Your hair was trying to tell you something, his cardiologist explained. If we hadn't caught this now, you would have been in the emergency room within months. Can you imagine? His hair, his subtle changes, literally gave him a second chance. So, here is what you absolutely must do today. Take a moment and gently run your fingers through your hair right now. Is it coming out more easily than before? Perhaps more than 100 strands a day? Has the texture suddenly changed from smooth and lustrous to brittle and dry? Is there an unusual pattern of loss emerging? Perhaps more on your crown, your temples, or a general thinning all over? These aren't just cosmetic concerns for your vanity. They could be life-saving warnings, signals from deep within. If you notice these changes, take a clear photo of your hair, especially any thinning areas, so you have something to show your doctor. And please make an appointment with your doctor this week. Specifically mention the sudden changes in your hair and ask about possible connections to your heart health. Don't wait for more serious symptoms to appear. By then, significant damage may have already occurred, and our options become more limited. Remember, catching heart failure early often means simpler treatment and much, much better outcomes. Why take the risk of waiting even one more day when you have these clues right in front of you? If this advice feels like a real eye-opener, comment "healthy" below. Your good habits inspire others, and we're all in this TOG sign 3, swelling in specific facial areas. Sign 3, swelling in specific facial areas. Sign 3, swelling in specific facial areas. Have you ever woken up and noticed your face looking a bit puffy or swollen, especially around your eyes? Do your cheeks or the area around your eyes just look different in the mirror than they used to? A subtle change that perhaps you've dismissed? This, my friends, could actually be one of the most overlooked signs of heart failure that experienced doctors spot right away. It's not just a bad night's sleep or too much salt every time. Here's the medical explanation. Simply put, when your heart starts to weaken, it can't pump blood as effectively, leading to something called fluid retention. This means your body holds on to extra water. Heart specialists at the Mayo Clinic warn that this fluid retention, a common issue with a weakening heart, often shows up first in the face, particularly around the eyes and jaw. Why the face? Well, this happens because when your heart can't pump efficiently, fluid can start to back up throughout your body. And when you're lying down sleeping at night, gravity causes that fluid to collect in the lowest places. When you're horizontal, that includes your face. Dr. Marielle Jessup, Chief Science and Medical Officer of the American Heart Association, explains it clearly. Morning facial puffiness, especially around the eyes, can be one of the earliest visible signs of fluid retention related to heart failure. It's your body collecting moisture where it settles most easily overnight. Let me share the story of Martha, a kind 69-year-old retired librarian from Wisconsin. For months, she noticed her face looking increasingly puffy in the morning. She tried everything she could think of, changing her pillows, cutting back on salt in her diet, even spending money on expensive creams, just assuming it was just part of aging or some stubborn wrinkles. But it persisted. Then, at her daughter's wedding, a relative who hadn't seen her in years made an offhand comment about how her face had changed, looking a bit fuller. That comment, innocent as it was, finally prompted Martha to mention it to her doctor, and what they found was significant. Tests revealed moderate heart failure that had been developing silently for months. Those changes in your face weren't aging, her doctor told her gently, yet firmly. That was your body's way of warning you that your heart wasn't keeping up. It's a powerful reminder, isn't it? So, here's what you need to do. Tomorrow morning, right after you wake up, before you even have your coffee, take a really close look at your face in the mirror. Pay special attention to the area around your eyes, your cheeks, and your jawline. Is there noticeable puffiness that wasn't there a few years ago? Does it seem to improve throughout the day as you're up and moving around, as gravity pulls that fluid elsewhere? For a clear comparison, take a photo first thing in the morning and another in the evening. If you notice persistent morning facial swelling, especially if it noticeably improves when you're upright during the day, call your doctor this week. Specifically mention this pattern of swelling and ask about heart-related fluid retention. Don't wait for more dramatic symptoms like swollen ankles or trouble breathing to become apparent. Early intervention, catching these subtle clues, can prevent irreversible heart damage and help you maintain your quality of life. Is your own reflection trying to tell you something your body desperately needs you to hear? Sometimes, the mirror holds more answers than we realize. Doesn't Martha's story just make you think? Comment "insightful" if it resonated with you. It helps others know they're not alone. Sign 4. Visible skin. Color changes. Now, this is the sign everyone around you can see, whether you notice it yourself or not. The color of your skin, that canvas of your body, might actually be broadcasting your heart health to everyone who looks at you, even strangers. And let me be clear, this isn't tea about the normal changes that come with tanning or a few age spots. This is about very specific, distinct color changes that signal dangerous heart failure. From a scientific standpoint, it's quite remarkable. Researchers at Harvard Medical School have meticulously documented that certain skin color changes are so strongly linked to heart failure that experienced doctors, with their trained eyes, can often make a preliminary diagnosis just by looking at a patient. It's a subtle art, honed by years of observation. The reason is simple. When your heart isn't pumping efficiently, that vital, oxygen-rich blood doesn't reach your skin properly. This lack of good circulation causes subtle but distinct color changes. Dr. Andrew Waxler, a cardiologist and respected member of the American College of Cardiology, states, "The skin is essentially a canvas that reflects what's happening with circulation. Certain color changes, particularly around the lips, nail beds, and earlobes, can be immediate red flags for heart failure." Our skin literally tells a story. Consider George, a rugged 75-year-old retired construction worker from Arizona. George had always been active and healthy, a real go-getter. But his barber of 20 years, the one who sees you more often than your family, the one who sees you up close, noticed something concerning during a routine haircut. It wasn't obvious at first, but there was a bluish tinge to George's lips and a grayish cast to his complexion that simply hadn't been there before. "George, you need to see a doctor," his barber insisted with a worried frown. "Something's not right with your color." When George finally, and somewhat reluctantly, went in for a checkup, his doctor immediately ordered cardiac tests. The diagnosis? Congestive heart failure that required immediate intervention. "Your barber may have saved your life, George," his cardiologist told him frankly. "These color changes have probably been developing for months." Imagine that. A keen-eyed barber making a life-saving observation. So, here's what you need to do right now, without delay. Go look at your skin in good natural lighting, perhaps near a window. Pay particular attention to your lips, the inside of your lower eyelids, and your fingertips. Do your lips have a bluish or purplish tinge, rather than a healthy, vibrant pink? Does your skin have a grayish, almost ashen cast to it, looking a bit dull? Is there a yellowish tinge to the whites of your eyes? Or a pale appearance to areas that should normally be pink, like your gums or the inside of your lower eyelids? If you notice any of these color changes, please take a clear photo in natural lighting and see your doctor within 24 hours. These aren't just cosmetic concerns you can ignore or cover up. They're potentially urgent warnings of poor circulation from a failing heart. Tell your doctor specifically about the color changes you've observed. Remember, the earlier heart failure is caught, the more treatment options we have, and the better your chances of maintaining your health and independence. Don't wait for chest pain or shortness of breath to hit you. By then, significant damage has often already occurred. If you found that truly surprising, type "shocker" in the comments. It's okay to be surprised. This stuff isn't taught in school, but we all need to know. Year sign: changes in ear appearance. Now, here's a body part most people never give a second thought to in the mirror: your ears. When was the last time you really looked at your ears? Probably not recently, right? Yet, this seemingly unimportant area could be showing one of the most scientifically validated signs of heart problems that doctors recognize immediately. It's fascinating how our bodies are so interconnected, isn't it? According to robust research published in the American Journal of Cardiology, specific changes to earlobe appearance strongly correlate with coronary artery disease and even heart failure. This isn't just an old wives' tale, it's a medically recognized phenomenon. In fact, this connection is so well established in medical literature that it even has its own name, Frank S. sign. Dr. Elizabeth Jackson, a distinguished professor of cardiovascular medicine at the University of Alabama, explains it beautifully. A diagonal crease in the earlobe has been repeatedly shown in studies to have a significant association with coronary artery disease. It's something cardiologists always notice because we're trained to look for it, but patients rarely do. It's a tiny, quiet indicator that speaks volumes to a trained eye. Let me tell you about Walter, a pleasant 72-year-old retired teacher from Pennsylvania, who, like many of us, went for a routine checkup. During the examination, as his doctor was going through the usual paces, she noticed something: diagonal creases running across Walter's earlobes. Now, Walter himself had no symptoms, felt perfectly fine, and was quite surprised when his doctor immediately ordered cardiac tests based solely on this single observation. The results were truly shocking. They showed severe blockages in 3 major coronary arteries, a serious condition known as triple vessel disease that very often leads to heart failure. "I had no idea my ears were trying to warn me," Walter said later, still a bit stunned. "I felt perfectly normal, but according to my cardiologist, I was at high risk for a major heart attack within months." Just imagine, a simple crease on his earlobe was a silent alarm. So, here's what you absolutely must do today. Find a well-lit mirror and really examine your earlobes. Do you see a diagonal crease running across either one or both of them? It often starts from the tragus, that little bump in front of your ear canal, and goes down and back across the earlobe. This isn't a normal aging change, like wrinkles on your face. This is potentially a critical warning sign. Also, while you're there, check for any unusual thickening of the earlobe tissue or any noticeable changes in the earlobe's overall shape that weren't there before. If you notice these ear changes, please don't wait. Take clear, close-up photos of your ears so your doctor can see them, and make an appointment with your doctor this week. Specifically mention the earlobe creases and ask about their connection to heart health. These simple, often overlooked observations could literally save your life by catching heart disease before it progresses to advanced heart failure, giving you the chance to intervene early. Isn't a quick, careful look in the mirror worth that peace of mind, knowing you're doing all you can to stay healthy? If you're already looking in the mirror, comment "checked" below. Let me know you're taking action for yourself. Sign 6. Unexpected dental and oral changes. Believe it or not, your mouth, your very own mouth, could be showing the very first signs of heart failure, long before you ever feel that chest pain or shortness of breath. This is one of those hidden connections that truly amazes me, even after all these years. These changes often go unnoticed or, again, are simply dismissed as just getting older, or perhaps, "I need to brush better." But doctors and dentists working together immediately recognize them as potential, crucial warning signs of heart problems. Let's talk about the science here. Dental researchers at the University of Pennsylvania, among others, have established clear and compelling links between certain oral changes and cardiovascular disease. It's all about circulation. When your heart isn't pumping efficiently, it directly affects blood flow, not just to your fingers and toes, but also to your gums and other delicate oral tissues. This can cause visible changes that, as research now shows, often precede other, more obvious heart failure symptoms. Dr. Lisa Stevens, director of the Cardiovascular Oral Health Connection Research Program, puts it plain and simple. The mouth can serve as an early warning system for heart problems. Changes in gum appearance, unexplained tooth mobility, or persistent bad breath that doesn't respond to normal oral hygiene can all be red flags for poor circulation related to heart failure. Your mouth truly is a window to your overall health. Think about Frank, a friendly 70-year-old retired postal worker from Florida. Frank started noticing his gums bleeding more easily when he brushed, and he developed a persistent bad breath, a kind of metallic taste, despite diligently brushing and flossing twice a day. His teeth had also become more sensitive without any clear explanation. Frank, being a practical man, assumed these were just normal aging changes, and maybe he needed a new toothbrush. But his dentist, during a routine checkup, became genuinely concerned and gently suggested he see his physician, mentioning that these oral symptoms could be connected to something bigger. When Frank finally saw his doctor and mentioned these specific oral symptoms, adding them to his other general feelings of fatigue, tests revealed early-stage heart failure. "Your mouth was telling us your heart was struggling, Frank," his cardiologist explained. Most people wouldn't connect these symptoms to their heart, but they're actually closely linked. It just goes to show you, no detail is too small when it comes to our health. So, here's what you need to do immediately, today. Take a moment and carefully examine your mouth. Really look. Are your gums receding more than before, or appearing purplish rather than a healthy, vibrant pink? Do your teeth feel looser than usual, or have you developed unexplained sensitivity to hot or cold? Has persistent bad breath appeared that just won't go away, despite your best efforts with good oral hygiene? Take a moment to look at your tongue too. Has it developed a whitish coating or an unusual texture? If you notice any of these changes, make an appointment with both your dentist and your doctor this week. Tell them specifically about the oral changes you've observed and ask about possible connections to your heart health. Many patients I've worked with report that their dental problems were indeed the earliest sign of heart failure they experienced. A sign that could have led to an earlier diagnosis and easier treatment if recognized properly. Don't dismiss these changes as just getting older or something minor. They could be your body's desperate silent attempt to warn you about your heart. If this surprised you, comment "Unbelievable" below. It's truly amazing what our bodies tell us, isn't it? As we wrap up, we've explored 6 critical grooming signs that can truly transform our understanding of heart health in our golden years. But knowledge, my friends, is only powerful when we put it into action. So now, I have one important question, a personal challenge, just for you. What is the one commitment you are making to yourself after watching this video? It could be as simple as, "I will check my nails more closely tonight," or "I will really look at my face in the morning." Maybe it's even, "I will call my doctor this week about that subtle change I've been seeing." Please, share your personal commitment in the comments below. Let's inspire each other to take that first step, to empower ourselves, and to truly build a community of care. And if you found real value, real insight, and genuine inspiration in our time together today, please show your support by giving this video a like. Just a quick click. To ensure you continue on this journey with us and never miss another video full of life-changing wisdom designed just for you, hit that subscribe button. It's more than just subscribing. It's joining a community, a family, really, dedicated to living our healthiest, happiest, most independent lives together. Finally, think of one person, just one friend or family member over 60, who absolutely needs to hear this message today. And please, take a moment to share this video with them. You might just change their life, just like Robert's barber changed his. Thank you for watching. Stay healthy, stay wise, And I'll see you in the next video, where we'll explore even more ways to embrace your best golden years.